safeguarding our health during this crisis of COVID-19. We also have launched today the first ever World's Nursing Report, and it's my great pleasure to have with me in the program tuning our expert behind this report, Carrie McCarty. Carrie, how are you today?
Hi. Good, thanks. Thanks for
Con-
having me on.
Congratulations on the first ever World Nursing Report that is launched with our partners. We dedicated the whole year 2020 to nurses and midwives, and today we are paying special attention to their work, but also to their needs to do their job even better and help us even better. Can you please tell us what is the what is the importance of this main importance of this report given the crisis we are facing?
Thanks, Alex. And we're really excited to be able to share this report. It is some of the best data that we've ever had on the health workforce, and the first time we've been able to do a report like this on nursing. And nurses make up half the health workforce generally, so it's really important to have good data and to be able to have a synthesis of the best evidence on which to make decisions for strengthening the health workforce. This report describes the nursing workforce quantitatively, how many nurses there are, where are they, what are their ages. It also defines the shortages of nurses in different regions, and that's critically important given the COVID crisis because we know there are a shortage of health workers, there aren't enough nurses, and this report goes over some of the information we need to know and also policy options for how we can start to address those gaps and also strengthen the nursing workforce overall.
Thank you, Carrie. Before we move to the highlights of the report, I would like to invite our viewers to ask their questions on how they can support nurses around the world or how their voice can support health workers. Please ask your questions on Facebook through the comment section and tell us where you're watching from. And if you're watching us on Twitter, please use hashtag AskWHO and ask your question, Carrie, and she will be responding immediately. So, Carrie, before the questions arrive, what are the highlights of this report you would like our viewers to remember?
So overall, we've seen a growth in the number of nurses. We have more nurses than we did in 2013, and we have about 29 million nurses globally. But we don't have enough nurses. Those nurses aren't equitably distributed. So we're actually not we have more nurses than ever before, but they're not in the places that we need them. About 89% of the nursing shortage, which is about 6 million, are found in low and lower middle income countries. So when we're thinking about reaching our basic health targets of universal health coverage, as well as being able to prepare and respond to epidemics, there's some places that are really falling behind that we need to focus on going forward. We also have some key findings and advancements in nursing practice and in nursing education and nursing leadership roles. At the same time, we still have to really increase the number of nursing graduates, particularly in countries with shortages. We would need to work harder to advance nursing leadership and ensure countries have national nursing government chief nurses or equivalent positions. So the bottom line is we need a lot of investment in the nursing workforce and their jobs and education and leadership, working conditions as well. This report highlights working conditions and regulations of nursing, and also looks at the migration of nurses, which is increasing and has particular implications when we think of exacerbating nursing shortages in terms of responding to COVID. We also made projections of what the nursing workforce is going to look like in 2030, and so given what we see, we really need to focus on addressing those shortages and inequities.
Thank you, Carrie. How this investments in education and jobs in nurses will help us to build more resilient health systems and be better prepared for epidemics and pandemics like we are facing today?
So a couple ways. Most countries need to increase their nursing graduates. They need to increase them, and alongside being able to recruit and employ and retain them in the health workforce, And that links back to the capacity of the education institutions to have enough nursing students, have enough nursing faculty, to have clinical placement areas, and then focus the content of that education according to the population needs. So in many places, that is primary healthcare focused. We're seeing that in COVID as well, to strengthen the public health approach, but also incorporating that epidemic preparedness, emergency preparedness, and response content in nurses so that they graduate and they're ready to work in the workforce and contribute to the population health goals. So there's a number of areas that relate to how the graduates and there's investing in nursing education is really going to help us achieve our health goals. And as I mentioned, once those graduates need to have jobs that they can move into, and when they're in those jobs, they need to be able to work to the full scope of their education and their training so that they can make a maximized contribution to the health priorities.
Thank you, Carrie. You mentioned that we have a big shortage of nurses around the world, and that this also shortage is not equitable. That about 80% of shortage is concentrated in low and middle income countries. And you mentioned as well nursing migration. Can you elaborate more on that and how big this issue is?
Mm-hmm. Yes. So among those 29 million nurses that we have, about 80% of them are in countries that represent about 50% of the population. So right there we can see that's a highly inequitable distribution. The shortages are greatest in the region of the WHO regions of Africa, Southeast Asia, and the Eastern Mediterranean. When we look at the density of nurses, meaning how many nurses there are per population, in say a region like the Americas, which is the same population level as the region, the African region, there's a tenfold difference in the number of nurses to population in the Americas region as there is to Africa. Overall, this is really income driven. So in high income countries, we also see a tenfold increase in the number of nurses in high income countries than in low income countries. So that density per population, those number of nurses per population, has a really big impact on how services are delivered and whether people can access services by having enough nurses and other health workers in the health system. In terms of migration, we're seeing a lot of increase in migration, not just from lower and lower middle income countries to high income countries, although that is ever increasing. We're seeing migration that's different patterns. For an example, from different regions in the south to the Eastern Mediterranean region, or even within the African region, for example. The thing is, right now we don't have as good a data as we need on this. We need better data on the migration of nurses and the recruitment of health personnel overall. So in the report, we make a clear recommendation for countries to use their national health workforce accounts, which is a tool for health workforce reporting that was used to populate this report. And it also is used for monitoring the global WHO code of practice on the recruitment of health personnel. So we really need, we know that it's increasing, and we really need better data from all countries around the world to make sure the migration is managed ethically and responsibly, and that we can ensure that the out migration of health workers doesn't exacerbate and make worse local health challenges that already exist in terms of providing services to the population.
Thank you, Carrie. Thank you very much. I'll invite once again our viewers to ask their questions on how they can support nurses in their communities, or to tell us who is their favorite nurse and why they are grateful to their nurses. Before we get more questions, Carrie, could you explain as well what is WHO's role and what is WHO? How is WHO supporting countries to invest in education and jobs for nurses?
Thanks. Well, the report is intended for a wide array of audiences, including country governments. And what we really push for is using the data and the evidence of the report to have dialogue, policy dialogue, across the country with all types of stakeholders. For example, within a country, to look at what are the issues that are needed, the state of the world to need to be addressed. The State of the World's Nursing Report has a country profile on all of the countries that provided data for the report, which was over 190. So we are hoping that countries use use those country profiles in order to identify the priorities that they need to address and what are some of the policy options to begin doing that. Our regional offices of WHO have a large role in supporting countries in developing their health workforce and their nursing workforce in particular. So we hope this report is a resource for them. The policy dialogue also can happen at that regional level and a global level when we can make decisions about where are the investments most needed and where are the investments going to have the most impact in strengthening the health workforce as a primary healthcare team. So those are some of the ways that we hope the report is going to be used at the national, regional, and global level. As the data is public, it's available to anyone wanting to use it for analysis, for research, for advocacy. It's out there for everyone to use. So we hope that everyone takes hold of this and uses it to advocate for strengthening nursing and the whole health workforce.
Are there any successful examples, or just to give a little bit of a look to our viewers, um, situation or example where actually investment in education and jobs for health workers and in particular nurses has improved people's health? We know we have evidence for that, but just giving some story.
Sure. And actually, there's two examples in the report. One is from Oman, and Oman had improving health outcomes with increasing global, they're increasing economic status. So they had a higher level of non-communicable diseases. So they decided to invest in a nursing education program for community health nurses so they could work with populations in the community on primary care and preventative services and addressing non-communicable chronic diseases in the community before they go to the hospital. So that was a successful program. That was an education level program that they developed. And now they have the example in the report shows that they've had increasing community health nurses and improved community health services by nurses. Another example of a policy change that impacted nursing education as well as practice is an example that we highlight from Poland, where there was again a decision that they wanted to increase access in the community, access to health services in the community. So they use nurses to do that as they're already well positioned to do so. And they decided to expand the prescribing ability of nurses. So that meant they had to do an upstream change in the regulation of what nurses can prescribe. They had to change the nursing education so that they're educated and prepared to prescribe in the practice setting. And then nurses had an increased ability to prescribe medications and treat patients for non-communicable and chronic diseases in the community. And that was a really successful program for them as well.
Thank you very much, Carrie. And here's the question we receive about the training of nurses. Should more emphasis be given during the nursing training on the fundamentals of nursing, sorry, as a subject?
Yeah, thanks. Interestingly, in the report, we found that nursing education, the average duration of nursing education is about 3 years. We have show a range between 2, 3, 4, and 5 years, and the majority was at 3 years. So we know that the nursing education is getting longer, and within that is an opportunity to cover absolutely the fundamentals, absolutely primary care, and the things that are specific to the communities that they're going to be serving. So as I mentioned, that's primary care, but it also might be epidemic preparedness. It might be health-related manifestations of climate change. It really depends. I don't think there's any question that nurses always need those fundamentals in primary care. We're also seeing in the report that there's evolution in nursing practice. Over 50% of countries reported they have an advanced practice role for nurses. In some countries, this was related to even a lower density of physicians in the country, but not necessarily so. We also, in the report, review some of the best evidence about nurse-led models of care. So having nurses in those positions where they're in the community and they're autonomously providing those services that are effective for primary care, preventative care, and management of chronic diseases. So we think there's a wide role of nurses, and it really depends on what the health system needs are, and where nurses are employed. If there's a need to expand access, maybe there's looking at a role for another type of nurse like an advanced practice, but it really depends on what the health service delivery model is and how the health system is structured to absorb and make full use of those nurses, regardless of their role.
Thank you very much, Carrie. We received another question. What is the best way for us as individuals and populations to support health workers in our communities during COVID 19?
Yeah, this is a really good question. It's really challenging. I think the whole of the health workforce, anyone working at the front lines, is dealing with so much. The nurses in particular have a role in terms of everything from triaging patients and making those hard decisions about who needs what kind of immediate care, and then in terms of the continued vigilance that you have to have of patients on the floor. So in the report, we really emphasize the importance of decent working conditions for all health workers. And for nurses, sometimes this has an element of having gender sensitive policies because the nursing workforce is still overall about 90% female. So we know we need appropriate gender specific health policies. We need everyone advocating for fair pay of nurses. And we need to ensure that nurses have, and all health workers have occupational safe and health and safety needs met in terms of personal protective equipment. So I think having loud, clear voices on the need for those types of working conditions, without question, is something that we can all contribute our voices to.
Thank you very much, Carrie. We're receiving more good questions. How can we as a community motivate young people to become nurses?
Great question. We, as I mentioned, we see in terms of even gender, we don't see a lot of diversity in the nursing workforce. I think we need to strive to have a nursing workforce that represents the populations that nurses serve. So we need to make efforts to encourage people to come into nursing. Some of it, as I mentioned, is gender related. In some countries, nursing is seen as women's work. Caring for people is women's work, and it's not as highly regarded. So we need to change the perception of nurses. A lot of that will come, I think, from an increased attractiveness as a profession. A lot of that will come from improving the working conditions, improving the pay, eliminating that gender bias and stereotyping. So some of the policy options we outline in the report for that go back to how we're recruiting and supporting nursing students. How are we getting the most diverse, appropriately diverse student pool? Are we providing them, are they being provided clinical placements in the types of communities, for example, rural communities that they want to go back and serve? So there's a lot of ways we need to address both in the incoming nursing students and with the ways that we portray nursing and the way that the nursing profession is working in terms of working conditions and supports.
Thank you, Carrie. We have another question coming from our viewers. Is there an ideal ratio on nurses to patients?
In terms of if they're talking about safe staffing within hospitals, we don't go near that in the report because there is wide variety. The health system and the health services have the best sense at a country level of what are the best ratio of nurses that are needed in say any given health facility. It depends on the acuity, it depends on the context, the disease burden. It really depends on a lot of factors. What we can speak to in the report is the density of nurses per population as a benchmark, looking for making sure that at least the essential services for achieving UHC are met. And so that's how we calculate some of the shortages and how we can strongly advocate for where those jobs are needed and where increases in the education of nurses are needed.
Thank you, Carrie. We have another question coming. How is nurses' situation in Africa?
So as I mentioned in when I was talking about the number of nurses, there's a lot fewer in Africa in real terms and relative to the population. So this is one of the regions that we need to greatly increase the number of nursing jobs and the number of nursing graduates. For those countries that have shortages of nurses currently, we are recommending an increase of about 8% of graduates per year. Not recommending, I should say that in order to fill the shortages in all countries, to eliminate the shortages in all countries, we can tell that an increase of 8% of graduates alongside an ability to employ and retain them could help eliminate the shortage in many of those African countries, which are part of the countries that make up where the biggest gaps are. That type of increase in education goes along with about a $10 per capita increase in spending on nursing education. And we're talking about both that 8% increase and $10 per capita increase from now through 2030 in those countries that have shortages, which Africa definitely does. Um, Overall, we know that the number of nurses is going to increase into 2030, but if we don't make the kind of changes that I mentioned, if we don't increase the number of graduates along with our ability to retain them, and we don't increase the spending on nursing education and jobs, most of the increase from the 29 million to 36 million in 2030 is going to be two-thirds in the high and upper middle income countries. So the growth is not going to happen where it's needed most unless we really focus that investment and those increases in jobs and education.
Thank you, Carrie. Thank you very much. Um, this report was done together with some of our partners. Would you like to mention something about that collaboration, please?
Yes, thanks. Our partners, our co-chairs on the report were the International Council of Nurses and the Global Nursing Now campaign. These are really key partners for us because in terms of nursing stakeholders, they represent some really important constituencies. ICN, the International Council of Nurses, has over 130 member associations representing and advocating for nurses. So those are professional nursing associations and unions. So they have a really key voice in identifying those policy issues for nursing and also spreading and sharing information about nursing on the ground in the nursing report. The Global Nursing Now campaign is a fantastic platform. They really had amazing results in terms of grassroots movement for nursing and getting people excited and aware of the nursing workforce. So they were really important for information awareness and advocacy on the ground. They, along with other nursing stakeholders, like the government chief nurse in the country, nursing regulators, educators, other government ministries, really work together on the ground in country to collate this evidence that we use for the report from all kinds of different sources and to validate it and to get it reported up through the National Health Workforce Account System. So without them, we would not have been able to reach the scale of reporting that we did. And we really have reached a new high in health workforce reporting. This report on nursing has data from 191 countries. Overall, it's a 53% increase in the last time we released data on the health workforce in 2018. So thanks to our partners and those stakeholders on the ground, we really have been able to put together a report of a different type of scale than we've seen before.
Thank you, Carrie. This is the year of a nurse and a midwife, and we just received a question about midwives. Is there any program to support and intensify the presence and action of midwives as a part of the personnel necessary in the delivery rooms? And would you be able to tell us what is the plan on reporting for midwives? Do we expect to have something similar like we had this report this year on the nurses?
Yes, yes. Actually, there have been two State of the World's Midwifery reports in 2011 and 2014, looking at the number of nurse midwives, where they're located, and what is the unmet need for the delivery of essential services that midwives provide. Right now, UNFPA, along with WHO and the International Confederation of Midwives, are working on the third iteration of the State of the World's Midwifery Report. So that is also data is being reported currently for that, and it will be released in May of 2021. So that will be a really important document and a continuation, if you will, of the celebration of nurses and midwives next year as well, and also this a highlight on the midwifery workforce.
We are receiving some more questions. How is nurses' pay compared to other industries? How we can fix their pay?
The pay of nurses is a concern. We think that there is, in general, because nursing is such a highly feminized position, that there is overall lower pay of nurses compared to other health professions, um, such as medical doctors and others. What we look at, what I think is important is if there's a gender-related pay gap, and we've been trying to look at this within nursing, and the data isn't full enough yet for us to make a clear conclusions about that. In some instances, we see a pay gap, and in some instances, we don't. But we do know that that just by virtue of the nursing workforce being as feminized as it is, that there is lower pay and there is gender bias. So we're in our policy options, we're asking for fair remuneration of nurses and also elimination of any gender pay gaps within nursing.
Thank you, Carrie. Here's the last question for today. What are the arguments or recommendations for governments to invest more into nurses and midwives?
Some of them I mentioned already, particularly in those high shortage countries. So we're looking at investment, increasing the number of graduates, increasing the number of jobs for nurses, and that goes throughout the country, throughout the world. A lot of countries need to take a close look at the aging profile of their nursing workforce as 1 in 6 countries are going to have more nurses who are retiring in the next 10 years than the numbers that are coming into the workforce. So we need to look at domestic production of nurses. Also, all countries can help retain their nurses, so that's improving working conditions, improving aspects that we know work to keep nurses motivated and in their practice settings. We also are asking governments to look at improving nursing leadership. So those government chief nurse officer positions, as well as leadership development programs. We found those to be highly related to improved working conditions and stronger education regulation within countries when you had a chief nurse and nursing leadership development programs. So those are the education, jobs, and leadership. We're also saying that countries should consider um, absolutely keeping track of nurse migration and health worker mobility overall, and being able to report on that, being able to improve data, because this report was based on the data that countries could report. And while it was better than ever, there are really key gaps, particularly around nursing education, health labor market flows, and migration. So where countries can help by implementing the code of practice on health worker recruitment, and also working conditions, improving working conditions and pay. So those are some of the things that were really come out strongly in the report in terms of policy considerations for governments.
Thank you, Carrie, and thank you everyone from watching us from Indonesia, Chile, India, Nepal, South Africa, USA, Mozambique, Bangladesh, Belgium, Kenya, India, New Zealand, Malaysia, Australia, Sri Lanka, Mexico, Philippines, and many other countries. Thank you for celebrating World Health Day with us today. Thank you for celebrating nurses and midwives and all health workers around the world today. Please join us and share the stories why you are celebrating your nurse and why or and midwife, and why do you respect them and love them so much. Join us in these efforts to thank health heroes today. Carrie, do you have your last personal message maybe for nurses and midwives and health workers around the world today?
Thank you for joining, and we're really pushing for investment. We're really pushing to strengthen the nursing workforce and the whole health workforce overall, because we see from COVID how crucial it is. So we hope this is the catalyzing moment, the focus of the world and the evidence in the report. And I think together we need to look forward to the next 10 years and how we make a really big difference, strengthening the nursing and midwifery workforce as part of the broader health workforce team. And doing that, we can reach universal health coverage and be able to respond to emergencies better.
Thank you. As our Director General would like to say, together for a healthier and safer world. Happy World Health Day to everyone, and follow us, our channels, with more information today. And also this afternoon, we'll have another live interview, which will include several nurses and midwives from around the world. So please join us and hear their stories. Thank you very much.